Hello, everyone. Hey, this is Steve Tracy. Hey, I wanted to take a break today from my Saving Grandma videos, and there's something that's been near and dear kind of on my mind for a long time now. I worked in the industry, the senior care industry, during the COVID, and so I just want to do a very short video, and the video is called Killing Grandma. Did Grandma really die from COVID? In 1932, there was this famous radio program that all the people listened to because they didn't have TV back then. And one of the famous ones was The Shadow. And it had this actor with this radio actor with a really deep voice that sounded really gruesome. And on that The Shadow, he would say, "Who knows what evil lurks in the hearts of men? Only the shadow knows." And this kind of reminds me a little bit of what went on during COVID. I was an administrator during COVID with the senior care facility and saw a lot of crazy things going on. And I wanted to bring it to everyone's attention because it kind of seems like since COVID has passed, everyone's kind of just let it go. But I have this feeling and this sense that there should be a lot of people that should be charged with criminalities. There were a lot of people who died, some unnecessarily, and a lot of it was just the way the government handled COVID. And that, through the CDC, was passed on to all of us administrators. We would get on the phone with them sometimes daily, and their regs seemed to change on a regular basis on how you handled COVID. You know, during that time period, it's really interesting, but up until March of 2023, there were 1.1 million deaths related to COVID. My question is, were they really related to COVID? I mean, there was a lot of games going on, a lot of dollars being shuffled around, being given to different institutions and facilities. During that time period, between 2020 and 2023, there's around 307,000 people 85 years and older who died of COVID. But then I asked the question again, did they really die of COVID? The government kicked out about $135 billion to hospitals and to health-related based facilities. And I often think maybe we need to follow the money because there were people, I think during that time, I swear you could die of a sprained ankle and they would call it COVID related. And why did they do that? There were so many statistics that were being accredited to COVID because dollars were being given to institutions from the government. And so everybody wanted to get more dollars with all this COVID related care. And a lot of it was a bunch of hogwash. A lot of it was very similar to mask. You know, we were all wearing masks and wearing personal protective equipment when people were dying of old age. And I mean, people were not able to see their loved ones when they were dying. I saw communities where the families had to go outside the facility and look through the windows to visit their loved ones. There were isolation where people were put in isolation so they wouldn't catch COVID. But it broke all the rules. For 30 years, we had this very strong rule. It was called resident rights. And the residents were supposed to be treated with dignity, and they had the rights to choose. And suddenly when COVID came around, all of that was broken too, and we did a huge disservice to the elderly people. There were $135 billion given from the government to these different institutions. And so many people died. Some of them died of natural causes, which is a normal thing. But of course, everybody checked the box COVID, that they died of COVID, when a lot of times it wasn't COVID. It's because they wanted the dollars. So this is a short video. I just wanted to, I'll have some more videos related to this. I'm doing my podcast videos on saving grandma, things you can do to help grandma and save grandma. But I'd like everybody to kind of question, did grandma really die of COVID? In a lot of cases, I was there. I was in the mix of it all. And I think, again, with all, as is with so many government entities, there was very poor, it was poorly done. COVID was miscommunicated in so many different ways, and the people who paid the highest price were the elderly senior population, and it's near and dear to my heart. So anyway, you'll see some more videos. I'm questioning really the government. I'm questioning a lot of their data that they kicked out. We already know that most of that data was incorrect. All of it was being guided by dollars and cents. And so we had all these millions of people dying, but did they really die of COVID? Some did. Absolutely, some did, but not all. And so I want everybody to question that. And I will have, basically this is Killing Grandma, my short video. Did Grandma really die from COVID? Maybe not. It's something to really think about. Anyway, please, I invite you all to come to my podcast on YouTube, and that is called Saving Grandma, and I'll continue to share these tidbits of information. Take care. Have a good day.